It's time again for Cumberland Healthcare's Closer to Home show with Dr. Craig Jennings. Dr. Jennings, last week we talked about protecting yourself from the sun.
Today we are going to talk a little bit more about the downstream effects if we don't protect ourselves from the sun and focus on skin cancer. There are three major types of skin cancer: melanoma, squamous cell carcinoma, and basal cell carcinoma. Melanomas tend to be darker in color and can be confused with a mole. Therefore, they should be checked regularly. Squamous cell carcinomas often look like scaling, dry, coarse skin. They can be relatively fast-growing. Basal cell carcinomas often appear as a scab that is not healing well. They tend to be slower growing, but can still become dangerous if not addressed. You should seek medical care if a spot on your skin is new or an existing spot is changing. Some risk factors for developing skin cancer include excessive sun exposure, sunburns, being fair-skinned, family history of skin cancer, or if you've had other skin cancers removed in the past, and having an increased number of moles. People who are at high risk of developing skin cancer should have regular skin checks with either their primary care provider or dermatologist.
So what can we expect when you have a skin check?
The provider will typically evaluate all of your skin with a special focus on the high-risk areas such as your face, neck, ears, and the top of the head in men, to name a few. If a skin lesion is found, there are a number of different approaches. Some can simply be watched over time if they are not at risk of developing into cancer. Others will need to be frozen with liquid nitrogen, a procedure called cryotherapy. If the spot is concerning for skin cancer, then there are a few different options, and they vary based on the location, size, and suspected type of skin cancer it may be. Your provider may decide to do a biopsy, meaning that they only remove a portion of the spot in order to help determine if it is cancerous and what type. The provider may decide to remove the spot completely as well. We perform all these procedures and skin checks at Cumberland Healthcare. Lastly, some people may need to be referred to plastic surgery or dermatology. If skin cancer is not excised early, it can spread locally to affect the surrounding skin and structures under the skin. It can also spread throughout your body, called metastasis. The longer people wait before having a skin lesion evaluated, the more likely it is to be problematic. Fortunately, when skin cancer is caught early and removed, it has an excellent prognosis. In summary, the best way to prevent skin cancer is to decrease skin damage from the sun. And if you have a new or changing spot on your skin, see your doctor as soon as possible.
If you have any questions, please contact Cumberland Healthcare at 715-822-7500. This has been Cumberland Healthcare's Closer to Home with Dr. Craig Jennings. It's time again for Cumberland Healthcare's Closer to Home show with Dr. Craig Jennings. Dr. Jennings